Hello everyone, my name is Priya Singh Rangey and I am an assistant professor at the LJ Institute of Physiotherapy. Since the past few videos of mine, we have been discussing about vocational evaluation and vocational rehabilitation. Today, we'll be continuing on the same lines with vocational rehabilitation team. So today we'll be discussing about what are the different members of a vocational rehabilitation team. The members include a vocational counselor, an evaluator, a trainer, which is a skills trainer, and a placement officer. So these are the four different members that comprise the vocational rehabilitation team. And the most important member of the team, which is the client. We cannot forget about the client here. So, starting with the vocational counselor, vocational counseling includes professional and personal counseling. It is not just that we are providing only professional counseling pertaining to the vocation of the individual alone. No, we also have to focus on the personal problems that the person might be facing, the individual might be facing, because as we know that any personal issues, if left untreated, are going to have an impact on the professional life as well. So when we are giving counseling to such an individual, we have to see that we are covering all the aspects, both professional as well as personal. And this is the job of the vocational counselor. The vocational counselor analyzes the life of the patient, both the personal life and the professional life, and tries to counsel and help the patient in any manner that is possible. He incorporates an additional focus on the theory and research of career development and the unique vocational needs of individuals with disabilities. As we know that such people might be having some extraordinary needs that the normal people, the people who are able-bodied, may not be having. So it is the job of the vocational counselor to see to it that these needs and these demands are fulfilled. The goal of vocational counseling is to assist and empower individuals with various disabilities, including neuropsychological, to achieve their career goals in the most integrated setting possible. We also have to see to it that the person does not feel themselves to be isolated by the community. We need to have an integrated approach. We need to have an approach that allows the patient to feel that they are a part of the society, they are a part of the community. We need to see to it that at the job place, the patient does not feel that he is isolated by his peers or colleagues, or the employer is not trying to be unbiased towards them. We need to see to it that the person with disability gets all the opportunities that an able-bodied person gets. The vocational counselor tries to identify the right vocation, the skill, or way of life of these patients. The next member is the evaluator. An evaluator is someone who is trained to conduct vocational assessment. Now, we have already discussed in my previous videos what is vocational assessment, what are the different aspects that are covered in vocational assessment. So it is the job of the evaluator to perform vocational assessment. He assists individuals in identifying suitable jobs and career paths. It considers information from several different sources, including input from the individual, to put together their career recommendations. In short, the job of an evaluator is to evaluate the client, try to identify their limitations, their strengths, their abilities and skills, and then to plan an occupation for such an individual based on their limitations or strengths, their abilities or skills. The next member is the placement officer. As the name suggests, the job of a placement officer is to place the person with disability for any vocation, depending on whatever occupation the vocational counselor and the evaluator have deemed fit for that particular individual. The placement officer places the disabled individual in a suitable job and visits the patient at the workplace frequently in order to do a follow-up, because it might be possible that when the person gets into the job, things might be easy for them, but later on things may start getting difficult. The person may not be feeling as comfortable as they used to. So it is the job of the placement officer to do regular follow-ups in order to see that the patient is not facing any problems, the patient is satisfied with the employment, as well as to talk to the employer whether the employer is happy with the employee or not. The placement officer coordinates with the social worker, the counselor, the candidate, and the employer regularly. So a placement officer acts as a linking person between the social worker, the candidate, the counselor, the employer, everyone who is involved in the vocational rehabilitation purpose. The placement officer needs to maintain a database of the candidate requirements and also a list of the prospective clients, so that the placement officer can match both these lists and can place the individual at the proper place. So it is the job of the placement officer to know about all the existing vacancies in all the different occupations in a particular market, in a particular geographical area. The placement officer can be employed by a non-government organization, or they may be employed by the employment exchange of the government. The next member is the special educator. Now, when we talk about a special educator, we are talking about people who might be suffering from congenital developmental disorders. For people who need to be educated in a special way, because they do not have the same understanding, they do not have the same mental intelligence that other people have. So a special educator is required for special teaching, specially educating such people. They teach special children and they attempt to recognize the deficits in the child's functioning. They work out the compensating teaching methods. They develop strategies in order to teach such children, so that such children can learn something and in the future they can get employment to some suitable place. The needs of such children, such special children, are difficult and different. So we need to see to it that whenever we are appointing a special educator, the educator needs to be such that they can work with such children in a more compliant manner. They are more cooperative with such children. And also the special educator needs to understand that with such children, there is a lessened emphasis on academic performance and there is more stress on practical life experience, because for such children, gaining employment and earning, being financially independent is more demanding than being academically well. So we need to look here at the needs, at the demands of the special children and work accordingly, and not decide whatever is good for them on our decision basis. The next member is the skills trainer. We need to understand that different occupations require different kinds of skills. Many a times it may happen that the person may want to go in a particular occupation, but depending on their physical limitations, depending on their mental limitations, we might need to send them to some other occupation which may require teaching them skills from a new phase. So for this we require a skills trainer. The different skills that are required for any successful work are foundational skills, which are acquired through education and family life early on in life. Technical and professional skills, which enable a person to undertake a particular activity or task. For example, if I am thinking of taking a job of say a clerical job, then I need to know how to perform the different tasks that a clerk needs to perform, like being good at computers, being good at bookkeeping, accounts, etc. Business skills are required to succeed in self-employment, because we know that based on the models of vocational rehabilitation, sometimes the person may want to go for self-employment. In order to go for self-employment, the person needs to have business skills. And core life skills, which include attitudes, knowledge, and personal attributes. So for any successful occupation, any individual needs to have all these different skills. And in order to develop these skills in any person with disability, we need to have a skills trainer, because the skills trainer is one individual who is going to train the individual in all these different occupations and the skills that are required for each and every occupation. So the skills trainer also forms a very important part of the vocational rehabilitation team. So that is what the vocational rehabilitation team comprises of. It is comprised of the vocational counselor, the evaluator, the placement officer, and the skills trainer, or in some special children cases, the special educator. It is the responsibility of each individual member of the team to make the client capable enough to gain an occupation, to maintain that occupation, and to achieve great success in that occupation. Only if each and every member of the vocational rehabilitation team is performing their duty to the fullest, it will be possible for the person with disability to continue their occupation and be successful in it. So that is where we conclude the vocational rehabilitation team. Thank you for listening.